10 o'clock, I understand that the former US President Barack Obama will also give a live address, and I think this will be pertaining, of course, to the events that have been taking place in the United States over the past a few days since the killing, of course, of George Floyd. You'd want to stay tuned here to the channel for all of that. Healthcare workers and people over the age of 55, as well as those with comorbidities, will be prioritised for COVID-19 testing in the public sector in the Western Cape. This is part of the province's revised testing strategy amid a nationwide shortage of test kits and a backlog of some 27,000 outstanding test results. Western Cape Premier Alan Winde says pressure on the testing system has necessitated triage facilities. One facility has been opened at the Red Cross War Memorial Children's Hospital in Cape Town.
The Red Cross War Memorial Children's Hospital in Cape Town says it has had 37 children testing positive for COVID-19. 7 are currently in hospital. The triage and testing centre, which was officially opened today, will add additional capacity to the hospital. Ill patients and caregivers will be screened and tested here, and if necessary, will be admitted to the main hospital.
That's a running total from the beginning, and what you're finding, a lot of those children have comorbidities. So obviously the kind of patients that come here are children that are known to us with comorbidities and seem to have COVID by the way. So they're not all coming here just because of COVID. They're coming here because they've got pre-existing conditions and then happen to have COVID as well.
Of 77 staff who had tested positive for COVID-19, 44 are back at work. The province is now in its second phase of rolling out triage centres. 20 more are due in the next phase in rural areas of the province. There are some 27,000 test results outstanding due to the backlog. 19,000 of these are for longer than a week. Testing will now be prioritised for those most at risk.
It really is putting pressure on the system, and when you have that kind of pressure on the system while we're waiting for new tests to come into the country, we need to make some management decisions. So the management decision now is the tests that we have got, let's make sure that they're the most effectively used, and so that's in our hospitals. So it is either patients being tested when they're coming in, or specifically our frontline staff. So our nurses need to be tested regularly, so we give peace of mind and stop too much viral load, etc. So that's real first priority in our hospitals. And then, of course, outside of our hospitals, who's vulnerable? And elderly, so over 55, we're saying that then you'd receive a test as a priority. Or if you've got a comorbidity, over 55 or lower than 55, because you're also at risk.
The province now has just over 24,500 confirmed cases. There's been nearly 14,000 recoveries and a death toll of 601. Vanessa Puna, SABC News, Cape Town.